Ministry of Health would like to inform the general public that Uganda has confirmed her first case of coronavirus disease, COVID-19.
A new virus has been discovered that has pandemic potential, according to Chinese scientists.
The death toll from the virus rises while the disease continues to spread across the world.
Fear engulfs the Ugandan population. Individuals with means rush to stock food. Prices of basic commodities shoot high. The worst was yet to come.
The government has decided to suspend for 14 days now all public transport. And this means all taxis, all costas, minibuses, all buses, all passenger trains, all tuk-tukus, the tricycles, and all the boda-bodas. These all are suspended.
A curfew is declared on 30th March 2020 at around 8 p.m. and takes effect at 9 p.m. on the same night. On the 12th April 2020, the president announces a total lockdown. Everything shuts down. The once busy streets are deserted. Everyone is engulfed in fear, locked in their homes.
What we've seen is that COVID-19 brought back the vulnerability of the LGBTI community to the up close. We saw at the very start of the lockdown, government officials, politicians taking advantage of the fact that they have the phobia for LGBTI people. They used COVID or the presidential directives to actually attack the LGBTI community.
When they announced the regulations about locking down the country, my partner and I had just given birth to our daughter. She's 4 months. And I think it was 2 days after she was born, and the president put out the regulations for the lockdown. And we were, first of all, frightened, because when you have a newborn baby, you must be able to access your pediatrician. The person that has gone through the childbirth must be able to see their doctor when they can. And here we were being told you cannot get out to go see, you cannot access your doctor unless you have written documentation that allows you to travel to see your doctor.
COVID came as a shock. We didn't have much information about exactly what is COVID, how is it transmitted. There was scant information, but it created a lot of fear in all of us, including me.
And all of a sudden we were told lockdown, especially border districts, transit routes, sex workers at high risk because you're interacting with the truckers. So everything was like upside down. So it really affected us in terms of fast services. So what happened was, when all this happened, we got stuck. We didn't know what to do.
COVID didn't find our communities in a place where they were socioeconomically ready to deal with the measures that government was putting in to address COVID, even when they were for good intentions. Because like they say, the road to hell is paved with good intentions. So what we saw is, in Uganda we had a very tough lockdown that's still going on, that's relaxed a bit. The nature in which it was enacted being that, for example, the quarantine centers were binary gender centers, and that allows no access for transgender people who do not fall under these binaries. And so we had trans communities who even if they wanted to self-report and quarantine with the government quarantine centers, they couldn't, because there was this stigma around that. But also you have to know that in Uganda, these communities are criminalized, so you would be scared to expose yourself or trust a government that criminalizes you to protect you in case you had COVID.
Everyone is affected, that's for sure. Every single Ugandan has been affected, and I guess this is also the world over. So there are other groups, however, that have suffered much more than other groups. Other LGBT group is among these groups. Because COVID-19 exacerbates an already bad situation. And I'll come to my area, which is access to justice. I think there people again suffered much more than the other groups. In terms of access to justice, the courts are closed off, basically. So during the lockdown, the courts were largely locked. You couldn't go to court, and where the courts were allowed to handle only urgent matters. At the same time, the government imposed a curfew so that you can't move, go to different places at different times. There was no public transport. And the police and army were in charge of enforcing this curfew and enforcing the lockdown.
To get to the hospital, people need permits from resident district commissioners, RDCs. Endless queues of desperate sick people and pregnant women emerge at RDC's offices across the country. Bribes are solicited for one to get a travel permit.
And as queer people, you're faced with the issue of, okay, if I am in an emergency situation, how do I explain that I am actually the parent to this child? How do I explain that actually my partner is going through something and I need to get them help, but I need to, when I go to the LC person or the person that was supposed to give the permission, will ask me what is my relationship to this person. And if I say that I'm their partner, it's going to become something else. And if I don't say that I'm their partner, they're going to refuse me the permission. It was frightening, but I think for me personally, because I have the family structure that understands my sexuality and understands that beyond everything else, beyond my queerness, I am their sister, I am their daughter. I had the privilege of having my family step up for me. My family stepping up to ensure that our child has diapers when she needs them. We have mental support when you are new parents who need to navigate how do you deal with the child. You queer people who maybe haven't gone through the process.
LDUs, a semi-militia force affiliated to the country's armed forces, unleash brutal violence against all those breaking the presidential directives. The situation gets out of hand to the extent that LDUs are pulled off the streets. With a long history of harassment and discrimination, LGBT persons live under constant fear of repression and are pushed to survive in an unwelcoming environment.
This resulted in the arrest and the raid of the Kosof shelter, whereby over 23 people were arrested, and it resulted into 20 of them being held in jail for almost 60 days.
LGBT people in Uganda are faced with brutality, arrests, and homelessness every day. COVID-19 worsened the already dire situation.
So basically, the argument was these are people, more than 20 people in the same house, and they are going against the COVID-19 regulations.
The charge was doing a negligent act like to spread infection of disease. So basically, the accusation was that you were 23 people in a house. That means you are doing something negligent to cause infection of disease. That's COVID-19. However, the presidential directives had nothing at all against people being together in a home. In fact, the directives were clear: you should stay at home.
So in reality, they are not violating any rights, any of the COVID-19 regulations. The police is picking them up because of some already premeditated reason, which is their sexuality. So if you look at the videos that recorded the arrest, if you look at the mayor of Kyengera, Haji Chirimba, beating up these suspects and asking them questions about their sexual orientation, it has nothing to do with COVID-19. It has all to do with their sexual orientation and gender identity. So then COVID comes in as the convenient excuse that, oh no, we are not arresting them because of COVID, because of their sexuality, we are arresting them because of COVID-19. But this is just an excuse. And also, like I said, we are told to stay at home. They were staying at home. You can't pick them up for staying at home, meaning there was some other reason behind the arrest. The case was of a particular challenge to us because as lawyers, the first day they were arrested, public transport had been stopped, but we had our private vehicles, so we could access. The problem came in with the second day when they had been taken to the police, and then they were due to be taken to court. That same evening, in the morning they would be taken to court, the president announced a ban on private vehicles on the roads. Lawyers were declared as non-essential. That essentially mean we couldn't get anywhere near our clients. From here off to the court is about 10 or so kilometers. So the lawyers, we told them, well, you must go there. So they woke up and tried to walk to court. And that was kind of complicated. You have to walk, and then there are all sorts of curfews and police on the road and asking where you were going. They walked, but it was too late because by 9 they had been taken to the court, and then the court immediately remanded them. The court did not even allow them to get off the sand track on which they were taken to court, and they were remanded to prison. When the lawyers got there, the court was closed. There was no one, no magistrate, no prosecutor, no clerk, nothing. And then the next question was, where have they taken them? We didn't even know where they had been taken. So we went around on a wild goose chase. We immediately got a sand truck, because sand trucks were allowed to move at the time. We got a sand truck that would be able to carry some of our lawyers. So we went to Kabasanda prison. We went to Kitaria prison. The Kitaria prison denied having them. And we went back to Kabasanda. Kabasanda prison was like, no. If they have come from Unsanji, they have been taken to Kitaria. So we called Kitaria again, and this time around the Kitaria OC agreed that the clients were at Kitaria prison. So we go to Kitaria prison, and the Kitaria prison denies us access. They're like, well, no one can access any prisoner at this time, not even lawyers. So they told us you can only access them if you get permission from prison headquarters. We drove to Kampala. Now Kitaria is about 45 kilometers. So we drove to Kampala to prison's headquarters. Prison's headquarters told us, well, we cannot grant you access. We told them to put it in writing. They put it in writing. And the reason they gave is, we can't give you access because of COVID-19. To me as a lawyer, it was quite clear that the right to a fair hearing is a non-derogable right. It's a right that you cannot limit, even whatever justification. So even in times of a crisis, even in the times of COVID-19, you couldn't limit the right to access lawyers. So we went to court and filed an urgent application at the High Court to allow us to access our clients. Of course, the process was much longer because you have to file, first of all, an application for a certificate of urgency. That took a week for the court to give us a certificate of urgency that our matter was urgent. The second application was an application allowing us to go and see our clients as the case proceeds in court. And the third application was the challenge to the violation of the right to a fair hearing. So there are 3 court cases in one. We won the first one, got the certificate of urgency, but a week passed. So meaning our clients continue to be in prison. And then they were due to come back on 18th of April of the next month. And they were not brought to court. So we told court, these people have not been brought to court. That day the court had another hearing, and this time around they granted us access, an order allowing us access to the clients. So we go to Kitaria and serve them with the order. They allow us in this time round. No restrictions. We go see our clients, speak to them. We found them in a bad condition. That by then it had been like 42 days since they were arrested by the time we went to see them. We found them in a bad condition. They had been beaten. They were being denied access to HIV service, basically not directly, even though there was little medicine available in the hospital, in the prison, but also indirectly, because they would just call you out that whoever is HIV positive, come for your drugs. And for an LGBT person already marginalized, and then they are also revealing your HIV status out in public, that was a no-no. So many people did not pick medicine because of that. So they had been beaten, subject to torture because of their sexual orientation and gender identity. So we served them with the court documents and left them there. We hear later on the documents were taken from them. So after that, we used multiple processes. We went beyond the courts. We went to the Attorney General. I had to appear personally before the Attorney General to demand that these people are given a chance to appear in court. We also went to the Chief Registrar of Courts, demanding that we need a courtroom where our case would be heard, where the case would be heard. We also went to the magistrate and wrote to her asking that we have, because at that time, Chitara refused to bring them. So the only way we could do it is to get them on video link from Kitaya prison to a court that had video link. Now, Nsangi court doesn't have video link. It's a small thing, no video link. So we had to go, the only court that had video link was Buganda Road. And Buganda Road was booked with a huge line of people wanting to appear, their cases to appear. So we tried to push, but it failed. But good enough, the case was coming up again on a Tuesday. So we went to the DPP, the Director of Public Prosecutions, and made a case. I wrote a long letter, attached evidence of how the arrest was done, urging the DPP to withdraw charges against the accused because the charges were unfounded. There was no connection between staying in a house and violating the COVID-19 regulations. Lucky enough, when we appeared in court, the DPP withdrew charges. And so all the 20 were supposed to be free. By some error on the record, in the letter that we wrote and also on the file, because the name was very much hidden, we had 19 names instead of 20 names. And so we painfully had to see one of the 20 remaining in prison for another week. Until we went again through the same process to have the DPP withdraw charges against them. By the time the last one came out, it was 60 days since their arrest. So this process, of course, eventually we won the case. We won the case on access to lawyers, and each of them was awarded 5 million. But I want to just paste a scenario, and it was many more people remained in prison, not LGBT, but other people weren't part of the case. Many of them remained in prison without any single access to lawyers.
That was a very clear indication that as a community we still remain vulnerable regardless of whatever situation, because every time government officials or homophobic people get an opportunity, they will use whatever they have to actually push and take away push the LGBTI community in a corner, take away their rights, and remind us how we are second citizens. And that is something that has been very clear during this COVID, and push the community back, push the community into fear.
This is not the first time LGBT community in Uganda is being persecuted. Previously, tabloids have published full names, addresses, photographs, and preferred social hangouts of LGBT people and called for them to be hanged.
We have had sentiments from policymakers who have called for renewed legislation. We have seen religious leaders who have come out openly to denounce homosexuality, and they are vowing not to, put their guns down.
As usual, the community was looking, the broader community of Uganda, there was a need to look for someone to blame for COVID. And so our communities, being LGBTQ and sex workers, were put at the center of this, in this moralization as a scapegoat, because it was, there was just a need to blame someone for why we're having the situation that we're in. And so at the beginning we had the national prayer meetings where the whole conversation turned into a religious conversation. And once such religious fundamentalist conversations start happening, they end up moralizing conversations. And moralized conversations are always bad for our communities.
We have seen these people also coming up and saying, this is punishment that is meted out because of homosexuality, withstanding or not looking at the side of science, what has happened.
It's a laughable situation. How do we influence science? What does what I do in the comfort of my bedroom create a pandemic? We know what it has taken for us to build a Kuchu community in Uganda, and people are not going to threaten us with telling us God is angry at us. We know our God. We also speak to God. We know where God lives. We know we can also talk to this God. You can no longer bank into misinterpreting the Bible to say God has said this. No, we're not buying that.
Again, the world is making a mistake whereby they are always finding a reason to blame or create a situation that it's due to LGBTI that something is happening. The question would be, Uganda is still criminalizing homosexuality, so why would it come to Uganda? Again, this is another moment for us to educate this kind of misinformation. COVID is a disease. It's a virus. And we all know science has told us that. So you cannot create whatever you may create to push an agenda that pushes or criminalizes the LGBT community is a process that actually puts the rest of the population at risk.
The lockdown has worsened life for the LGBT community. It has halted all community human activities for these hard-hit Ugandans who must work every day in order to earn and survive.
There is that, situation where people say if you are a certain age, if you are advanced in age, you are really hit hard when you get in contact with COVID. So personally, I was, at home, fearing to meet people. Although on phone and social media, I was getting a lot of calls for people who wanted help. And our colleagues, people who are in my age bracket, we also have a sizable number of people who are above 50. Others are approaching, and also people who are not really in that bracket, but who have underlying, conditions. Everybody was highly scared because, first of all, COVID has no cure. There's no vaccine, and it was an episode just like those early days of HIV, where if you are announced to be HIV positive, it's an automatic, It was a death sentence in the beginning.
The pandemic has brought back fresh memories of HIV/AIDS epidemic in the late 80s and early 90s.
We do have our gay, MSM, and trans communities that have HIV programming. In this country, it's very difficult to access healthcare services from public centers. So what the communities have done is to establish parallel centers, which are community-led, that would be able to provide these services. Unfortunately, these health centers weren't considered as essential places that would remain open during the lockdown. And so I don't know what this meant for, you can imagine what this meant for our colleagues who are like on ARVs or needed PrEP or any kind of these things, that they were not able to stay on ARVs and PrEP. But our communities are really resilient. They found out ways of being able to still sustain ARVs and relief support to their colleagues through the whole pandemic.
I'll tell you that some of the most profound work on HIV within the queer community has been done by transgender women living in places like Bwaise. People who are not literate, class literate, but understand their challenge, understand their community, understand how work needs to be done that creates the impact. We have survived this whole period because the community understands what our challenge is. We know what we need, what our members need, and how we need to get that done.
As key populations are still struggling to cope with the dire situation of lack of access to life-saving medicines and other forms of essential health care, they are confronted by another even bigger challenge, the lack of food.
Banneeko bafa bali eyo wansi enjala ebattira mu nnyumba n'omutuukako ng'ali mu kufa nga talina kyakulya n'eddagala n'asobola okuba nti alivaako.
The truth is, sex workers have given themselves drug holiday. Why I cannot continue taking drugs without food? Because the drugs actually we take, you must eat food. So you find it hard for someone to support her. You say you need to take drugs, but when they don't have what to eat. And I must say this, that we've lost about, I think, 4 people in Kitugu. We lost a girl, a sex worker and a daughter, just because people could no longer take their drug. Then we had 2 people, one for TB, also in Nepak, and also a sex worker died. Then we also have another sex worker who passed away in Kaboni. And all these were very champions, but living with HIV. We are not sure that actually that's the reason why they passed away, but we are very much, we think that because there was no food, it could also have contributed. So they could either no longer take their medication as recommended by the health workers, so they ended up failing to balance, because once you don't take your drugs, you know what happens to the body.
The government is forced to distribute food to the most vulnerable in urban centers. The distribution process is marred by delays, stealing, giving out rotten beans and corruption. Majority of vulnerable Ugandans, including commercial sex workers, not receiving any food at all or receive too little to last them a week.
Isaiah 26, verse 20. It says, you go in your house, lock yourself in, and shut the door, and wait for the anger of the Lord to pass.
Many LGBT persons have been pushed back to live with their homophobic families.
When they put out regulations that required people to stay indoors, it got me thinking about us as a community. We have quite a big number of people who are homeless, or there's a big number of people who live in shared accommodation. And most people are actually living in transit accommodation, where you have to sleep at your friend for these days, then move to somebody else. And here comes a situation that says you cannot go anywhere. And for me, the whole situation of us being told to stay indoors felt like more of, now we go back to depending on our family structures. How are you structured to go through isolation? And I think I thought about that. I thought about queer people who don't have that and what they must have been going through.
And this meant that for groups that are already affected by poverty, by discrimination, by marginalization, they had to face lots of challenges, much more than the usual groups, than other groups of people. For the LGBT group, one of the things that stood out most for me is the order to stay home. Let us stay home. Let us stay home. Be safe, be home. What does being safe, be home, mean for an LGBT person who has been evicted from their home before COVID-19? You are basically homeless, you have nowhere to stay, and they're telling you now have to go back to your parents or go back to your home and face the same people who are responsible for the violence that was meted against you. So for most LGBT people, this was a no-go area. They couldn't actually go home as it was stated.
We have created a community for ourselves as queer people, as LGBT people in Uganda. We have groups that we belong to, groups that have become family for us, because much as you want your natural family to understand you, not all of them are going to do that. And where they fail to do that, you cannot go through life struggling to belong with them if they don't want you. So we've turned to ourselves as a community.
But we have also seen an increase in IPV, intimate partner violence. We have seen gender-based violence. And these are all things that have come up because of COVID. So really, the impact on the extreme has pushed the community in that sense of direction.
Shops locked, streets deserted. There is no source of income. Everyone is desperate to survive.
Badde nkola nnyo ebiseera biri ebitabadde bya covid naye kati nti n'abantu bennyini bembadde ba clients bange olwaleero sikyasobola kubafuna bonna nti ofunayo omunakkubira essimu naye ne transport yennyini akutuusa waawe muyina okusinkana naye bwafuuse buzibu nti okola ekisoboka n'otambuza ebigere n'otuukayo naye olina kuba nti omusembezasembezaako sayidi zeeno nga togenda wala nnyo nti ne kafiya asobola okukukwata ng'ovaayo ate ne bakutwala ekitalya. Baatugambye ekkomera litulinze liri eyo kati tuli beegendereza nnyo naye nga simanyi na bwe tugenda kubeerawo kuba pulezidenti yatwogerako kitegeeza nti tetukyalina we tuyinza kukolera nti oli ne bw'aba yali akumanyi ng'akukubira akasimu kati takyayinza kukuyita olw'ensonga pulezidenti yakola ki dipaatimenti yaffe yagyogerako ebyaddala tetumuyina mu maaso gye tulaga tetulina mabega gye tudda.
People have actually chose not to notice that actually we have COVID. So people are taking risk. That I rather go and try my luck out there than to stay home, see my children cry for me, but then continue working. They could not actually access lodges with the trackers, so they choose to go to the bush. So they would actually continue offer services, sexual services, in the bush without condoms, without any protective measures. Then another crisis that also raised was issues of access to contraceptives, family planning. People didn't have all these services. So it was an issue that we were struggling. How do we get them commodities like condoms? How do we get them access contraceptives? How do we get them access refills, both PrEP and ART? So what we have also realized that COVID is with us, but the most important thing is we have now the messages, clear messages, information on the preventive mechanism. If we practice the guidelines by Ministry of Health, we can actually prevent.
To maintain the gains and continue advancing the fight for justice, LGBT community is strategically adopting to new and already existing innovations to continue working.
It reached a moment I couldn't go to office. I had to work from home. So again, the appreciation of sometimes you might not have the physical presence or working day to day with your colleagues, but maybe you work from home, and how do you remain effective? So again, that's something that we have learned, that as we are working and pushing towards this moment of COVID, we must ensure that we also encourage organizations to adopt to different means of administering. Because if you say, oh, I can know you're working if you only come in office, I think that kind of thinking has been pushed out. Say, okay, no, actually people can work from home.
We also moved faster to change our approach. You know, we started using a lot of technology, that is like social media, using internet and Zoom.
Organizations have been pushed into pre-planning, because if you can't have a physical meeting, then how do you communicate the information? So many tools online have really been on an increase in terms of organizing meetings, in terms of providing even services. I have seen organizations that have had to change the way they do their community outreach. And also in terms of providing psychosocial support. Organizations have been using telephone conversations whereby they call, they've been sharing numbers where community members can call to talk to a counselor, where they can call to talk to someone or a peer, but also they've been using what we call the social network services, whereby peers link to each other within like a cell. Again, those have been mechanisms that have been used to ensure that, one, people are social distancing, two, to ensure that people are actually continuously providing a service that is needed. And it is through that while there's been a lot of lockdown, but the community has continued also to thrive within that space, because organizations had to think fast and also develop mechanisms that would help them to survive. Like, how do we deploy all these new technologies as we continue to work and fight for justice? I think, one, there is need to build the capacity of our communities in terms of learning and knowing how to use these tools as a starting point, because again, some of these tools, yes, they are good, but also come with some impact, like vulnerabilities, security issues. So again, we're already a community that is criminalized, a community that is pushed in a corner. So again, we must be very careful in terms of how are we using these tools? Are we protecting the identity of the people? And are we ensuring that whoever needs to be on that call is the one who is on that call? So it's very, very important that all those security checks must be followed. And also, that will come with a package of really helping the different institutions, but also community members to know which tools they must use and how must they use them. And again, we've been used to a lot of paperwork and physical touch and everything. So how do we start in terms of advocacy? If you've been engaging Ministry of Health, you've been engaging Parliament. And now with COVID, here you are, you can't be going to them. So again, we need to adopt. Is this the time when we use phones to engage more? Is this the time we start to mobilize online and also ensure that the stakeholders we want to engage with are actually mobilized to be using the same tools? But also the other thing we need to think is about investing in technology. Because if we talk of this new normal and yet we are not doing anything to accommodate the new normal, then we are doing a disservice to the society. Because you cannot talk about new technologies when you have not increased or you're not investing in the new technologies. So which also means that offices or communities, or we need to work towards ensuring that people have access to internet, ensure that people have access to some phones that can help them access or get online. And of course, there's a question of sustainability. So we need to also think about that. So we must invest in technologies that we know we can sustain, something that communities can. And that's why we need to think critically when we are designing programs. We must ensure that the programs also speak to some of those. And also, it should be something that we must be talking and engaging with every partner that we're working with to support the community, so that you don't leave the burden of this investment to one partner. We must try to learn to share costs and also push them across the spectrum to ensure that different partners get to understand. And also we need to change our strategies. We need to rethink, how do we deliver? What's the delivery model? So again, if our delivery model was going to communities, peers, and having those big meetings, we cannot still maintain that model when you're actually looking at technology. And I think if we embrace technology, one is going to help us to cut costs in terms of meetings, but also it means that as we're cutting costs, we must be investing in tools that will help communities to be able to implement. If we don't do that, then everything will just scramble down. I think as the LGBTI community, what COVID has done is giving the rest of the society what we have been living with for the longest time, which is living in isolation. It's not something that is new to our community or me as a person, as an openly gay man. But COVID just emphasized that and pushed us more in that corner. And this is the time more than ever to support each other, because it affected our structure of support system. That was totally destroyed because we could not meet, we could not move. And that meant that people we need, people who support us, were not there. And more than ever, we need to start thinking to invest in such processes. And my other call is that this is not the time to cut resources. Because one, we have achieved many gains. And if we cut resources because we are thinking because of COVID we can't do some other things, it would mean we shall be driving ourselves back. So there is need to continue to support the different programs that organizations and communities are doing, but also ensuring that we support the accessibility to technology, and I think there is need to support time of transition so that people can adopt the different new tools, they can adopt the new skills, and also we need to give that period so that we just don't say continue implementing like nothing happened. So again, those are some of the things that I would call upon partners to consider and ensure that they support the different communities and organizations that they have been working with, so that one, communities remain relevant, but also the support is relevant because it's doing exactly what communities need.
As the world navigates the new normal, the LGBT community and sex workers in Uganda are banking on the resourcefulness of their members and holding on to the hope that the relevant stakeholders, including government of Uganda and the donor community, will not abandon them.